Thank you, Dr. Dar. I believe my presentation has got problems technically, so I'll just have to talk. It's about, I think when we talk about mass gatherings, and particularly when we've been in recent years talking about Hajj, the first thing people think about infection, outbreaks, stampedes. And certainly about 15, 16 years ago, when we became more conscious of the public health aspects of mass gathering like Hajj, which happens to be the most well-worked out, well-studied, well-defined aspects as far as public health is concerned. But we were faced with an outbreak, an international outbreak, some 15 years ago, of a meningococcal strain, which was quite a serious infection, resulting in about 20 to 25% mortality. And this was certainly something that was discovered, or we became aware of it in the UK. And since then, there's been a focus on that, in prevention of that infection. I think it's one example where, with the introduction of a proper vaccine, the outbreak came to a very abrupt end. So I think it was a powerful one intervention, if we would like to have, then that was what it was, and it was very successful. The Saudi Arabian government Ministry of Health every year reviews its guidelines for Hajj, about health, and then reviews and updates them. Since that outbreak, the use of the specific meningococcal vaccine, the quadrivalent vaccine, became mandatory. And I believe that has been the most significant public health intervention from a global perspective. I think the impact of it has been enormous, not just in terms of reducing the meningococcal infection, but it has had some perhaps not noticed effect, which is that for the first time, there has been this contact for people who are traveling, contact with a healthcare professional. A travel health person, a specialist would say, they'd like to really know, ideally, where somebody is going, what they're going to do there when they're there, how long are they going to stay there, and can we have a look at them when they come back. I think all those criteria are actually met with the Hajj, and that is something that we've not really taken the most advantage of in terms of other public health preventive activities. In that experience, what we did was found out how people were faring with the use of that vaccine or the implementation of that guideline. And there were immense difficulties we found in the people who were going for Hajj and Umrah to accept that vaccine, to receive that vaccine. One of the reasons for that was that it was the only vaccine for which people had to pay, because it's a travel one, and the demand was higher than what it could be met. And we found that people were being charged differently, and they were having difficulty in accessing the vaccine. So we worked with some of the companies, pharmaceutical companies, and discovered that, or it was suggested to us that the pharmacists are now able to vaccinate themselves as long as they go through some training process, which is called the PDGs. And we worked on that, and with the industry, with the people, and worked out a program where throughout the country, there were pharmacies who were participating in this process, in this program, and there was a very good uptake. So in the course of the 4 years that we've had that program, there's something like 1,500 pharmacy outlets, travel health clinics, and general practice surgeries who participated in that program, and that meant that that service was used by, in the last year we have had it worked out, 65%, 65 to 66%, 2/3 of the people who go for Hajj actually use that service. And what I'm proposing, therefore, is that we should use that as a way of enhancing our pre-travel processes and make sure that some of the other things that we very rightly talk about of how to prevent, the public health aspects of it, like other immunizations, teaching people about the health and other aspects of it, like heat-related illnesses and all that, could be properly structured. And I've been looking to see what other countries do, and I found in India a very good example of the most structured way, or one of the most structured ways of how people are sent for Hajj. It's a government of India undertaking, and 70 to 80% of people who go for Hajj are actually go through that process. There's a quota of 140,000 who go each year, and there's a medical mission which goes with that, comprising about 250 doctors. But before they go for Hajj, they've got to, first thing is they have got to apply well in advance. So they apply about, I think next month would be their application deadline before they go for the next Hajj. And then they're required to actually enter into a training program where they go and they're judged, and the government actually provides the vaccination. But in addition to that, they're required to produce a certificate of good health and fitness to be able to go for Hajj. Now, how that process works is a different matter, and I don't know. But the fact that it can happen and it's put out is something that we've got to learn from. And I would propose that we need, with the number of mass gatherings we've talked about, with the number of people involved in that, it seems to me that if we really want to put up a simple primary care system, maybe making compulsory for people who go for these mass gatherings, a pre-travel or pre-mass gathering screening program would be good. And that's what one of the proposals I'd like to make and consider, suggest it be considered. Thank you.